In 1981, Paul Starr, a Princeton professor, wrote The Social Transformation of American Medicine. He won a Pulitzer Prize for that work, talking about how the medical profession rose from a cottage industry to a highly respected, highly successful profession in the United States, the rise of community hospitals. And in 1981, he was talking about the next era being this corporatization of medicine that we'd be entering into. And he said that the driving fact there was that in 1981, we were at a stunning 9.8% of the gross domestic product in this country being spent on healthcare. 9.8%. Lee Iacocca soon afterwards said it was a known fact that at Chrysler, there was more money being spent on healthcare per car than on steel. That was 3 decades ago, and for the past 3 decades, we have focused mightily on improvement around our costs. You've worked on your supply chain, haven't you? You've tried to negotiate discounts and vendors and get scale in that, and now standardizing on fewer things, you can drive more volume in exchange for price concessions. You've worked at the labor, the hardest thing to tackle. How many people do we have, and what is the skill set, and how do we optimize that? And we've made significant efforts at improvement around our cost structure. And so fast forward from 1981, when we were at 9.8% of GDP spent on healthcare, to 2015, and we are now at 17.8% of GDP spent on healthcare, after 3 decades of improvement work on this. In 1999, the Institute of Medicine blew the lid off the patient safety challenges in our industry, sharing the 98,000 lives per year lost due to medical harm and error. And for 15 plus years, we have had thousands and thousands of improvement teams and areas of focus to look at the discrete practices that we can transform to make improvement. And on that 15th anniversary of To Err Is Human, there was lots of reports published to look at how much progress we've made. And as you probably know, the results are pretty sobering. Maybe it's that the harder you look, the more you find at times, but we know that really the harm rates have not improved all that much. Now, there's been areas that we have. There's specific issues that we've made improvements on, in eclampsies and CAUTIs and ventilator-associated pneumonia and falls and pressure ulcers, but the overall effect of this in the industry has not been where we wanted. So value is quality over cost, and we've had decades of work to improve both of those. We haven't been successful. The question is why? One is that it might be in the word itself. I also shared this morning my favorite quote from Wittgenstein, that you cannot enter any world for which you do not have the language. And so we have to define the difference here. Improvement is about doing things better. Transformation is about doing things differently. We have been in an era of improvement, and we will always be in an era where we're asked to improve, to do things better. But that will be necessary, but that is also now no longer sufficient. We have to be in an era of doing things fundamentally differently going forward, not just better. Has anyone ever heard of the phrase flavor of the month improvement? Right? So we've seen a lot of this. Organizations that would want to attack a discrete practice area, like let's say door-to-dock time in your emergency department. We've got a whole team of people this week focusing on those sorts of issues to transform emergency departments, and there's lots of sub-processes. And you can lean out your door-to-dock time, engaging your staff in all this performance improvement activity, and put the new process into place, and people are using it, and then you fast forward 2 months into the future, and it's now Saturday night in the ER. The weather's terrible, you're on divert, the patients are stacked like cordwood in the hallways, and you gotta ask yourself, what process will people use that night? Is it the one that is ideally designed but is kind of fresh paint? Or might people go back to the way they were doing things for the last 20 years? Because culture eats process improvement for lunch. There's a fundamental difference between short-term improvement versus long-term transformation. Now, let's forget about leadership and healthcare for a second. Let's just think about our own lives on the difference here between improvement and transformational change. Don't raise your hands if this applies to you. It'd be kind of awkward, but how many of you have lost weight for a few days? Thank you for your honesty, hand raisers, right? So the flu is a highly effective short-term improvement strategy for weight loss reduction. You get the flu and your Fitbit scale is going to talk to your watch and say, like, attaboy, human, I don't know what you did over the last few days, but that trend, that slope of improvement on weight reduction, fantastic, keep it up. And you say, well, computer, I'd like to, but I want to live, so I'm going to have to hydrate, and all that weight's going to come back on. That's not going to work. Not sustainable. Sustainable changes on things like weight loss are going to be about habit change. Multifactorial interventions, different ways of deciding and acting and believing. That's a whole other science than improvement. And it's the era that we're now adopting when it comes to our healthcare systems. And I say that plural, macroscopic across the world and microscopic in your team and all points in between. And it's why we're now seeing renewed demand for services to support you as a transformational partner, not just an improvement partner. We are increasingly being asked to do large-scale systematic transformations, cultural changes, in addition to the one-off practices of process improvement at the sharp end of the system. High reliability organizations, a concept that came vogue in healthcare in the 90s when we were looking for how other industries approach their safety issues. Frankly, that went pretty quiet for the last decade. We didn't hear a lot of people talking about high reliability organizations in healthcare. High reliability organizations like chemical manufacturing, long-haul trucking, nuclear power, and perhaps most famously commercial aviation that are inherently risky environments that almost never fail. And when you look at what they do differently, it's not that they have a whole bunch of process improvement committees. They do, they absolutely do. They also have a fundamentally different way of saying the world. I recently, with my colleague Dave Marshall, had the opportunity to talk to an organization that was focused on chemical manufacturing. And they said in our town, you know who works for this organization and who doesn't when they're mowing the lawn. Because the folks that work at our place, they wear steel-toed boots and protective eyewear and hearing protection because it's just a different way to live. And once it gets in your values, you can't shake it out. That's what transformational change is about. The Baldrige framework for performance excellence, a consistent set of systematic approaches that are fully deployed with learning loops. It's becoming more and more popular now in healthcare. In fact, healthcare really wasn't even part of that framework in the late 90s. And now the majority of applicants in that program are coming from our sector because they're looking for transformational work. And it's why I'm delighted that we've got Dave Duncan with us tomorrow from Innosight to teach us a whole new lens to look through, to ask the fundamental questions. What are your customers even hiring you to do? And are you matching that? Because it's not just going to be about asking them and making improvements along that. It's really got to be about a totally different way of acting. We will always be called upon to make things better, but we are now going to be called upon to do things differently. We'll be called upon that by regulators, large employers, our payers, our community, and we can be responsive to those requests. But what I'd really like us to do together as transformation partners is lead that change. So thank you for the work we've done on improvement, and here's to the era ahead as your transformation partner. Thank you very much.